Right now, some countries are cutting the length of time people are supposed to quarantine after exposure to coronavirus.
But CBS 2's Dr. Max Gomez tells us this approach is controversial.
Quarantining is meant to keep people who may have been infected away from others during the so-called incubation period of the virus. That's thought to be no more than 14 days for coronavirus. But if that time is shortened, will many infected people slip through the cracks? With many countries experiencing pandemic fatigue, compliance with a voluntary self-isolation of 14 days has been slipping. So some public health experts have proposed trimming that time to 10 or even 7 days. Already, France has cut their quarantine time to 7 days. Belgium went to 7 days, but then upped it to 10 after a surge in cases. Germany and the UK are also considering a shorter isolation time. This despite much of Europe seeing death rates rising steeply. Most studies have found that the average incubation time, the period from virus exposure to actually getting sick, is 5 to 7 days for corona. The theory is that more people will comply if the quarantine is just a week. But the dean of the CUNY School of Public Health says 7 days could still miss a lot of COVID-infected people.
If the cutoff was by 7 days, what percent of people would we be missing? And found that we could be missing as many as 15 or 20% of people could get sick after exposure.
And while 7 or 10 days may increase compliance, Dean El Mohandes says human nature is that with a 14-day quarantine, some people will start to skip out of isolation after 12 or 10 days. If quarantine is trimmed to 7 days, some people will leave well before they know if they've been infected. Dr. Max Gomez, CBS 2 News.